The nursing process is a modified scientific method which is a fundamental part of nursing practices in many countries around the world. The nursing process functions as a systematic guide to client-centered care. This process is also known as the ADPIE model, where S stands for assessing, D stands for diagnosing, P stands for planning, I stands for implementation or intervention, E stands for evaluation. First phase of nursing process is assessment. Purpose: this is the foundation of the nursing process. It involves a systematic collection of subjective and objective data about the patient's health status. Activities are as follows. 1. Data collection, gathering information from various sources, including patient, family and significant others, health records and other healthcare professionals. 2. Data organization, organizing the collected data into a logical and meaningful format. Common frameworks include Gordon's functional health patterns, body systems, or a head-to-toe assessment. 3. Data validation, verifying the accuracy and completeness of the data to ensure reliability. 4. Data documentation, accurately recording the findings in the patient's medical record. 2 types of data. First, subjective data, information provided by the patient, such as symptoms, feelings, and perceptions. Examples: I have a headache, I feel anxious. Second, objective data, observable and measurable data, such as vital signs, laboratory results, and physical examination findings. Second phase of nursing process is diagnosis. Purpose is to analyze the assessment data and identify actual or potential health problems that nurses are qualified and licensed to treat. Activities are as follows. 1. Data analysis, identifying patterns and trends in the assessment data. 2. Problem identification, determining the patient's health problems or risks. 3. Formulating nursing diagnoses, developing a clear and concise statement of the patient's health problem using standardized nursing terminology such as NANDA-1 diagnoses. 3 components of a nursing diagnosis. First, problem diagnostic label, a concise term or phrase that represents the patient's health problem. Second, etiology-related factors, the factors that contribute to or cause the health problem. Third, defining characteristics as evidenced by the signs and symptoms that support the nursing diagnosis. Types of nursing diagnoses. 1. Actual nursing diagnoses, describe existing health problems. 2. Risk nursing diagnoses, describe potential health problems. 3. Health promotion nursing diagnoses, describe a patient's readiness to improve their health. Third phase of nursing process is planning, to develop a plan of care that outlines strategies to achieve desired patient outcomes. Activities are as follows. Prioritizing nursing diagnoses, addressing the most critical health problems based on Maslow's hierarchy of needs or patient preferences. Secondly, setting goals and outcomes, establishing specific, measurable, attainable, realistic, and time-bound goals and outcomes. Third, selecting nursing interventions by choosing appropriate nursing interventions to address the patient's health problems and achieve the desired outcomes. Fourth, writing the nursing care plan, documenting the plan of care, including the nursing diagnoses, goals, outcomes, and interventions. Types of planning. 1. Initial planning, developed during the initial assessment. 2. Ongoing planning, continuously updated throughout the patient's care. And lastly, 3. Discharge planning, begins at admission and focuses on preparing the patient for transition to home or another care setting. Fourth phase of nursing process is implementation. Purpose is to carry out the nursing interventions outlined in the plan of care. Activities are as follows. 1. Performing nursing interventions, implementing the chosen interventions safely and effectively. 2. Delegating nursing interventions, assigning appropriate tasks to other members of the healthcare team when appropriate. 3. Documenting nursing interventions, accurately recording the interventions performed and the patient's response. 3 types of interventions. First, independent interventions, actions that nurses are licensed to perform independently. Second, dependent interventions, actions that require a physician's order. Third, collaborative interventions, actions that require collaboration with other healthcare professionals. The last phase in nursing process is evaluation. Purpose is to determine the effectiveness of the nursing interventions and the patient's progress toward achieving the desired outcomes. Activities are as follows. 1. Data collection. Reassessing the patient's health status to determine if the goals and outcomes have been met. 2. Comparing data with outcomes. Evaluating the patient's progress by comparing the reassessment data with the established goals and outcomes. 3. Drawing conclusions. Determining whether the interventions were effective and if the plan of care needs to be revised. 4. Documenting evaluation findings. Accurately recording the evaluation results. Possible outcomes could be: goal met, the patient has achieved the desired outcome. Or goal partially met, the patient has made some progress toward the desired outcome. Or goal not met, the patient has not made progress toward the desired outcome.